Welcome to the recorded version of Understanding Symptoms of Alzheimer's, part of the Family Caregiver Support webinar series brought to you by the American Society of Aging and a generous sponsorship from Home Instead Senior Care. Okay, our presenter today is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology, Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I'd like to turn the presentation over to Lakeland Hogan. Thank you for being here again, Lakeland.
Thank you so much, Steve. Hello, everyone. I hope your day is off to a great start. Thank you so much for joining in to talk about a subject that is really near and dear to my heart. It's one I'm very passionate about, and that's caring for someone living with Alzheimer's or another form of dementia. And today we're specifically talking about the symptoms of Alzheimer's disease. And while Alzheimer's and other dementias are not a normal part of aging, we are seeing more and more individuals affected by this horrible disease. Along with the growing number of individuals with dementia, we're also seeing more family members stepping in to provide care. So we're seeing more family caregivers. And in my experience working with these caregivers, their role at times can be very challenging, especially when families do not understand Alzheimer's disease and the symptoms that their loved one might present. Families often turn to us as professionals for resources and support. So thank you so much for tuning in to learn more about Alzheimer's and other dementias so that you can then share it with the family members that you work with, the family caregivers, people maybe that are newly diagnosed with Alzheimer's disease. So I just want to give you a quick overview of what we'll cover today. I'm going to start with the basics of dementia and talk about the different types. You might be familiar with dementia, you might not, so I thought we just level set so everyone is on the same page. And then we're going to dive deeper into the symptoms of Alzheimer's disease and how to minimize those symptoms. These symptoms specifically can be challenging, so if we provide caregivers with as much tools, resources, tips as we can, it can really go a long way in their caregiving journey. And then we're going to talk about person-centered care, which is really important to ensure that we still recognize the person, not just the disease. And it helps us keep the person really at the center of care. And this can really help families be more successful in the care that they provide. And then finally, we're going to talk about some resources that we can pass along to family caregivers. I'm also going to touch on a few self-care kind of tips for family caregivers because we know that if the family caregiver isn't taking care of themselves, it's hard for them to take care of their loved one. And in very extreme cases, we see family caregivers even pass away before their loved one with Alzheimer's or dementia just due to the stress and strain of the caregiving role. Okay, so let's dive into those dementia basics. Dementia is a decline in mental ability that is severe enough to interfere with daily life. And as I just mentioned, many people think that mental decline is a normal part of aging, but it is not a normal part of aging. Some people also get confused by the term dementia, and it really is a kind of an overarching term. You can see an umbrella there, so it's an umbrella term, and underneath that umbrella are the different types of dementia. So you'll often hear me say Alzheimer's and other types of dementias. While these types of dementias do differ, and I'm not going to dive into all of them individually, we're just going to focus on Alzheimer's today because it's the most common. These different types might present a little bit differently in an individual with vascular dementia versus Lewy body dementia or frontal temporal dementia. So, you know, an individual could have one of these types of dementias, or they might have a combination of dementias that can create a unique set of symptoms that their loved one might be exhibiting. So again, when we're talking with families, we can use Alzheimer's and dementia somewhat interchangeably, but we do want to let families know that Alzheimer's is a type of dementia and it is the most common type of dementia. So let's just talk a little bit more about Alzheimer's disease. Oh, I apologize. The font size made some of the bullet points go off the screen there. So again, I apologize about that. I'll try to do a good job of reading the bullet points. But first, Alzheimer's disease, again, is the most common form of dementia. We see Alzheimer's in about 60 to 80% of all dementia cases. And the greatest risk factor is age, but it is not just a disease of old age. Younger onset or early onset Alzheimer's affects people under the age of 65. And we know that about 5% of the more than 5 million Americans that are living with Alzheimer's have younger onset. And that really has a whole unique set of challenges. Oftentimes the younger individuals with Alzheimer's are still in the workforce upon diagnosis and maybe have to retire early or leave the workforce. So again, I'm not going to focus specifically on younger onset. I'm going to talk in more generalities, but know that if you're working with a family of an individual who's diagnosed, under the age of 65, there are a lot of great resources out there. The Alzheimer's Association has a whole set of resources for those who are experiencing this disease at a younger age. So it's important to connect them with those kind of more age-specific resources. But the reason Alzheimer's develops is still somewhat unknown, but we have research has shown that it does develop really in microscopic changes in the brain over time. So research is finding that these changes are starting long before the first signs of memory loss. And in Alzheimer's disease, there are two abnormal structures called plaques and tangles. And these damage and kill nerve cells in the brain. And you can see a little picture there on the screen that shows healthy cells in the smaller box and then the unhealthy cells in the larger box. And you can see those develop, those brown kind of clumps. Those are the plaques and tangles that can prevent the nerve cells from being able to communicate with one another. So these plaques are deposits of protein fragments called beta amyloids that build up in the spaces between the nerve cells. And the tangles are twisted fibers of another protein called tau that builds up inside of the cells. And through autopsy, studies have shown that most people develop some plaques and tangles as they age. But with Alzheimer's, they tend to develop far more and in a more predictable pattern, beginning in areas that are important for memory before spreading to other regions. Alzheimer's disease is also a progressive disease, which means that it will worsen over time. There are no current cures or treatments, prevention measures, but there are medications out there that can help reduce the symptoms or treat the symptoms to some degree. They don't work for everyone, but it is something to bring up with a physician if the individual is diagnosed with Alzheimer's. And when we talk about the progression of the disease, you'll hear it described in three general stages. So first is the mild Alzheimer's disease, which is really the early stage, so at the beginning of the disease, where there are some symptoms that are presenting, but the individual can still function fairly independently. And then in the moderate stage of Alzheimer's disease, or the middle stage, that's when the individual is showing some decline in their activities of daily living. They might need more support from family members. And then severe Alzheimer's disease, or late stage, is really when the individual is needing pretty much around-the-clock care, and that late stage results in end of life for the individual. And sometimes they pass away of complications due to Alzheimer's disease. So it's not always recorded as the primary cause of death. It might be Alzheimer's disease and pneumonia because the person can no longer remember how to swallow or is having swallowing issues. So perhaps a piece of food ends up in the lungs and causes pneumonia. So when you see some statistics here on this next slide, in terms of cause of death, we know that the number of deaths caused by Alzheimer's could be higher, but it is somewhat hard to track in terms of cause of death. So while there is currently no cure, researchers across the globe are really working hard to uncover more and more about Alzheimer's disease. So I want families to also know that there is hope. They're uncovering the different aspects of Alzheimer's and related dementias. And what is so interesting is this is somewhat a new field of study. 90% of what we know about Alzheimer's has really just been discovered in the last 20 years or so. So we have made pretty remarkable progress, but we know that there is still so much more to understand in terms of the brain and how these plaques and tangles are forming. How early are they forming? Are there preventative measures? Are there risk reduction measures that we can do at a younger age to prevent Alzheimer's later in life? And I had the privilege of attending an international Alzheimer's Research Summit this summer, and I was just blown away by the passion that these researchers have for finding a cure, for finding treatment. So we do need to communicate to families that there is hope, and we can talk to them about clinical trials because that will be what helps us get closer to a cure. So if family members want to participate or the individual themselves wants to participate, we can open that door for discussion. But again, that would be a whole nother topic, so I won't go down that rabbit hole. So instead, let's just talk about the statistics next. So it is good to put a little context around the discussion, and many of you may have heard these numbers already, but I'm going to share them with you again because it is really a worldwide issue. So we know in the United States, according to the Alzheimer's Association's most recent Facts and Figures report in 2018, that there's an estimated 5.7 million individuals living with Alzheimer's disease. And in the U.S., every 65 seconds, someone is diagnosed with Alzheimer's or develops Alzheimer's disease, and it is the sixth leading cause of death currently in the U.S. We know that 1 in 3 older adults will die with Alzheimer's or another form of dementia. And I mentioned that family caregivers are taking on this burden of care or this responsibility of care, and they're providing, in a year's time, 18.4 billion hours of care. And if we were to put a dollar amount to that, that is a whopping $232 billion worth of care that these family members are working so hard to provide to their loved ones. And then I know we have some people from Canada that usually join this webinar. So to the north of the U.S., there's about 747,000 living with dementia, and the costs associated with that are about over $10 billion a year. Then if we look from really a global perspective, we know that Alzheimer's disease is a global issue, and every 3 seconds, someone in the world develops dementia. So if you think about this 1-hour webinar that I'm doing with you all today, you're sitting in on it, just think of how many people are being diagnosed, developing Alzheimer's disease across the globe. And actually, Alzheimer's Disease International, they're an organization, they have put together a kind of documentary-style film called Every 3 Seconds that really takes a global look at Alzheimer's disease in today's day and age, because actually September is World Alzheimer's Month. So that's one of the reasons we're hosting this topic in the month of September. So if you're interested, you can just do a quick Google search for the Every 3 Seconds film that was put out by Alzheimer's Disease International. So I've talked a little bit about these family caregivers, so let's just talk a little bit more about them and the stresses that family caregiving can have on an individual. We know that Alzheimer's and dementia often results in memory loss, impaired judgment, the ability for one to take care of themselves decline. So they end up relying on others, and mainly family members, to help them with those activities of daily living, that extra support and care that they need. And we know from research that caring for an individual with dementia can be more demanding and more stressful than caring for someone who is ill but not cognitively impaired. We know that 59% of caregivers of people with Alzheimer's and other dementias rate emotional stress of caregiving as high or very high. And in addition, about 40% of family caregivers report symptoms of depression. And when you look at that in comparison to non-dementia caregivers, that rate of depression is only about 5 to 17%. So it is quite a bit higher in family caregivers who have a loved one with Alzheimer's and dementia. So that's just something as professionals we need to keep in mind as we are helping these individuals, these caregivers with support and resources. We need to make sure that we're addressing their mental health and well-being as well. And most of the care, again, is being provided by family caregivers. They're devoting a large number of hours to their caregiving tasks on a weekly basis. And these caregivers can often be in that sandwich generation where they're caring for a loved one with Alzheimer's and dementia. Perhaps it's a parent, an aunt or uncle, a family member. It could be a spouse. But they might also have children that they're caring for, grandchildren, which puts extra stress and strain. And then they also might be working outside of the home. So we just need to, again, take all of these things into account when we're talking with family caregivers. So again, we can help support them. And we also find that females are the most likely family caregiver. About 2/3 of all family caregivers are females. According to the Dementia Caregiving in the U.S. report that's put out by the National Alliance for Caregiving and AARP, nearly half of dementia caregivers say providing care is emotionally stressful, and 29% indicate physical strain. We also know that dementia caregivers are twice as likely to talk about how their health has worsened since starting care for their loved ones. And Home Instead did a survey, and we found that 74% of caregivers report that they have felt more isolated. Either their loved one is more isolated or they themselves as a caregiver have become more isolated. And they list some reasons for this. Some caregivers feel that they're unable to leave the house as often as they would like due to their loved one. Maybe it's due to their mobility restraints or some of the symptoms that they might exhibit in public. They feel possibly that there'll be a reduced quality of life for their loved one if they take time away from the caregiving situation and maybe higher respite. They might stay home because it's just easier due to that unpredictability of the symptoms that their loved one might exhibit. So again, we need to just keep these things in mind and talk to caregivers about whether or not they're feeling isolated in their caregiving role, because there's so much out there. Support groups, whether they're in person or online, that we can connect them with. Respite services so that they can get out of the house, get out and about to get that well-needed time away from the caregiving situation so that they can come back recharged and re-energized. So we've talked about some of these statistics and some of these numbers that surround Alzheimer's, people living with the disease, people caring for those with Alzheimer's. So now I want to shift the focus really to what we're here to talk about, and that's the symptoms of Alzheimer's disease. So there are some symptoms that are more common. And with Alzheimer's, we do know that over time, again, this is a progressive disease. So likely the individual with dementia or Alzheimer's will have more symptoms as the disease progresses. So at the start, they might just have a couple of these symptoms. And as professionals, we can help educate families on these symptoms so that if their loved one has not been diagnosed and they're thinking, oh wow, is this normal aging versus abnormal aging? These educating them on these symptoms can help them realize, okay, yes, these aren't normal. We need to get my loved one to the physician for a cognitive evaluation. So in many cases, these are some symptoms that might present in early stage, but again, it's important to note that these symptoms will likely start to appear or become noticeable over time. If the individual all of a sudden has multiple of these symptoms, maybe they're really confused and it really came out of the blue, it could be that there is another explanation for these symptoms and why they are occurring. So it's important, again, to get them to their doctor, to their practitioner to be evaluated. We know that urinary tract infections is one medical issue that can present some of the similar symptoms to cognitive impairment. So again, that can be easily treatable. So sometimes I hear from family members, well, I'm afraid my loved one won't want to go get evaluated, or I don't know how to have the conversation with them. They're resistant. And I talk to them about how it very well might not be Alzheimer's or dementia, but it's really important, if it is, to get an evaluation so that the family can be connected to resources. Or, if it's not Alzheimer's or dementia related, that they can be treated. Sometimes it's just a vitamin deficiency or some other issue going on. So according to the Alzheimer's Association, on the slide is listed some of the most common symptoms of Alzheimer's disease. So that includes memory loss that disrupts daily life. So one of the kind of early signs that there might be memory issues is reminder notes all over the house. We often see that when a person has difficulty completing familiar tasks, that can be another sign. The financial aspect of someone's life is oftentimes an early indicator. So maybe they're having trouble managing their bill pay or writing checks. That can be an early sign. Challenges with planning and problem solving. Maybe they were always able to recall this recipe from scratch, from memory, and now they're having trouble following recipes. That could be an indicator. They might have confusion with time and place. They may forget where they are, how they got there. I know we all walk out into the parking lot from time to time and think, oh my goodness, where did I park my car? I swear it was in this aisle. But we eventually can trace back our steps. It's more cause for concern when we're unable to trace our steps. That's, a common sign that there might be a cognitive issue happening. And then trouble understanding visual images or spatial relations. So sometimes the person will have a hard time judging the distance between things. So they might run into pieces of furniture, or in more drastic situations in driving a car, might hit objects. So again, driving is another area where early signs can appear. So we have some more common symptoms of Alzheimer's on this next slide. One is misplacing things or losing the ability to retrace steps. So the classic example here is losing keys. Well, I know I lose my keys almost on a weekly basis, but every time really, I retrace my steps and find them. And then I can remember, oh yes, this time I was carrying a bunch of groceries and sat them down in a spot that I don't usually set them down in. Decreased or poor judgment is another common symptom. You might find that the individual is giving large amounts of money to telemarketers or to charities that they haven't supported previously. Withdrawing from work or social activities. If you find that your loved one or the individual is maybe has stopped going to Bible study or bridge club, it might be because they're realizing that they're having some cognitive issues and they're embarrassed by it, and they no longer want to attend those social activities because they don't want those around them to pick up on this as well. You also might see changes in their mood or personality. They might become more easily upset, depressed, anxious. Again, some common symptoms that there might be some cognitive issues. And I apologize, that last bullet point says problems with speaking and writing. So they might stop in the middle of a conversation, have trouble finding the right word. Again, these might happen to you from time to time, but we can usually recall the word. Or in the middle of the night, we shoot up and say, oh, her name was Sally, those types of things. So, one of these symptoms might not be cause for concern, but when family members are seeing maybe one symptom happening more and more frequently, or a combination of these symptoms, that's when the individual really needs a medical evaluation. And one way that's easy to talk about symptoms is sometimes to break them down into two categories. So on this slide, I broke it down into cognitive symptoms and behavioral symptoms. And helping family members and individuals that are diagnosed understand these types of symptoms can really be helpful when providing care. And you might notice that I'm using the term symptoms and not behaviors, and really the term symptoms is being preferred in the industry. However, sometimes they are used interchangeably. And Alzheimer's truly is a disease of the brain that causes the person to have these types of cognitive and behavioral symptoms. So sometimes when we use the word, he's having a behavior, that kind of has a negative connotation to it. It really is, it's just a symptom of the disease that is attacking the brain. So it can sometimes be hard for families to grasp this concept that dementia or Alzheimer's is a disease of the brain. It's not their loved one being difficult. Or, their mom have always been a mild-mannered, sweet woman who never said a curse word, and now she's angry and agitated all the time. So these symptoms might be the result of some unmet needs that this woman is having, and we're going to talk about those unmet needs later. But we can help give families strategies and tools to help with these symptoms that their loved ones might be exhibiting. So again, back to the two categories, you can see I've listed a couple of examples under both. But when we talk about cognitive symptoms, sometimes it helps to use an analogy. And I heard a great analogy recently by Erin Benito. She's a dementia expert here in the U.S. And she talked about how when we're taking in information in a healthy brain, think of it as every fact that comes in is written down on a sticky note and it's stuck to our brain. And those sticky notes, when our brain is healthy, they have a really good stick. Sometimes you can get sticky notes that don't have a good sticky back. Well, these aren't those kind. They almost have super glue to the back of them. So we're taking in new information, and that information is sticking in our brains, and they'll be compartmentalized into various areas. But as Alzheimer's disease develops, the stickiness on those sticky notes starts to fade. So when a family member is frustrated because mom can remember my first tooth that I lost, and she can tell the story as clear as day, but she can't remember the name of my daughter that I had 2 years ago, that might be because her brain wasn't able to stick that sticky note to that part of her memory because of the disease. Or, that sticky note of what she ate for breakfast yesterday has already pretty much fallen out of the brain because the stickiness is gone. So if that analogy helps you, it might confuse you more than it helps, but it kind of clicked for me that, as we develop Alzheimer's disease and dementia, that information that comes in is not able to stick as well as it used to be able to. So it might cause confusion. It might impair their judgment. It might cause them to repeat the same question or repeat the same story over and over because they're not able to remember that information in the short term. And then when we talk about behavioral symptoms, we need to recognize that they are usually presenting because of some sort of unmet need, and we're going to talk about that again in just a little bit. But before we talk about that, these behavioral symptoms could be things such as anxiety, agitation, aggression, changes in their mood. And while some of these behavioral symptoms can be a little bit frustrating at times, others can be harmful to the individual or to the family caregiver. So I have a chart that I like to use with families, and I want to show that to you on the next slide. And you can feel free to, download these slides, copy them, use them with the individuals that you work with. But this chart does a good job of kind of spreading these out along these symptoms out along a continuum in terms of symptoms that might be frustrating, some that might be difficult, and then some that might be harmful to, again, the person who's living with the disease or the person caring. So this can be helpful at various stages throughout the disease, but especially when a person is diagnosed, a lot of times there is fear of the unknown. Family members are wondering, what kind of symptoms will my loved one have? How will I handle that? So this can be kind of a nice chart to lay them out. So if we take a closer look, again, some of these symptoms might be more frustrating, like repetition. When someone repeats the same question over and over again, such as, when is lunch? It can be very frustrating, but it's really not harmful to the individual or to the caregiver. And instead, we can encourage families to come up with creative solutions. I had a caregiver once who was dealing with that exact question, what time is lunch? And so we brainstormed some various responses that she could provide to the individual with dementia to hopefully reassure them every time that they ask. So sometimes she would, point to her watch and say, when the hand gets to the 12, that's when lunch is. Or, oh, we're going to eat in just a little bit, but first we're going to do this activity. Maybe it was taking a shower or doing a load of laundry together. So each time she came up with some creative solution so that she didn't get annoyed with the repetition and question, and every time that person felt like they got the question answered that they were seeking. So again, we can help families kind of think these through. And then other symptoms can be on that more harmful side, such as wandering, which we know is, of course, a dangerous situation if the individual is wandering outside of the home. We can create safe places for them to wander within the home or within a community setting, but we need to kind of talk this situation through and strategize. So when individuals are maybe coming to you with symptoms that are frustrating or difficult or harmful, we can use this to kind of help families navigate those various symptoms. I've been talking a lot about these unmet needs and how sometimes symptoms will present because there are unmet needs. So I want to share this quick check of 4 categories of unmet needs that an individual living with dementia might have, and therefore the symptoms are coming about. So again, as the disease progresses, the person with Alzheimer's is likely to have more difficulty in telling you what their unmet needs are, or the issues that they're having. They might not be able to communicate that they're bored or they're afraid. They might not be able to communicate that they are lonely, or they might not be able to communicate a physical need, like they're too hot or cold, or they need to go to the restroom. And then they might also be responding to their environment. Perhaps the room is too noisy, or they're overstimulated. So if we can get families kind of in a routine of doing some investigative work, I always talk about how caregivers are kind of like investigators, because they have to try to figure out what is the underlying issue for this symptom that my loved one is exhibiting. And so I wanted to give you a couple of examples of how we can translate a symptom to an unmet need and a solution. So, for example, if a family member finds their loved one pacing back and forth, it's perhaps that person is getting agitated. Well, it might be that the individual is trying to find the restroom, but they're unable to express that. They're unable to find their way. Maybe they've forgotten where the restroom is. So we can identify, okay, they might have a physical need. So we could say, John, I need help taking these towels to the restroom. Will you accompany me? And then that individual, once they get to the restroom, that caregiver might suggest, while we're in here, do you need to use the restroom? And see if using the restroom, if the result is that they stopped pacing back and forth. And the caregiver can maybe jot that down. I always encourage a journal to record the symptoms, what you tried, what did and didn't work. So then they can uncover a pattern and perhaps be more preventative. So hopefully they can help prevent these symptoms from happening again. In this case, maybe it is encouraging the individual to use the restroom about every 2 hours. That way they don't have to forget where the restroom is, and that sort of thing. So here's another example. If the individual is at a family get-together or gathering and they're getting really agitated, the caregiver can stop and think, okay, what might be an unmet need, and maybe it is environmental in this case. Perhaps there's too many people around. It's too loud. It's overstimulated. Perhaps they take the individual maybe to a quiet room of the house to see if that helps relieve that symptom, relieve that agitation. And perhaps they know then that at family gatherings, maybe a couple of family members come into that quiet room to visit with the individual for shorter periods of time, allowing them to rest, allowing them to have a more quiet environment. So if you can kind of just see the pattern of checking in with the individual's symptom, their unmet need, and then trying to find a solution, we can really help family members do that investigative work. So I've been talking a little bit about figuring out the person's patterns, figuring out the symptoms, and this really kind of all centers around what we call person-centered care, really getting to know the person and tailoring the care to their needs. So I want to talk more about person-centered care. This is an approach that really is becoming a gold standard in Alzheimer's and dementia care, especially in a facility setting or with professional caregivers coming into the home. And research has shown that person-centered care can help reduce agitation and aggression. It can also help to reduce the number of hospitalizations, reduce the need for antipsychotic medication, that sort of thing. So person-centered care can also be used by families. And what sometimes families don't realize is that they can implement these person-centered care practices into the daily care they provide their loved ones. And just this year, the Alzheimer's Association came out with their updated dementia care practice recommendations. And so they have guidelines geared towards professionals, but they also have recommendations from people living with the disease themselves. So I wanted to share those today so that family members can get a feel for the types of things that are important to the individual living with dementia so that they can help provide a more person-centered approach to caring for their loved ones. So the first is to get to know the person. The great thing about family caring for an individual with dementia is they already know the person. But they might be able to uncover more information if they talk to other family members, other friends, to get to know their story, get to know some of their likes and dislikes. It can really go a long way in helping with the care. And then they want to maximize their independence. So we don't want to do things for them. We want to encourage them to still do things on their own, but perhaps take a little more time to help walk them through step by step. They want patience and compassion. So we can encourage caregivers, instead of getting frustrated, to stop, take 3 deep breaths, and then try again. To really be patient with the individual and not to forget that their brain is failing. We need to be compassionate towards the fact that they're maybe losing their abilities, and it can be hard. And then we need to personalize the care to meet their individual needs and preferences. There's really not a one-size-fits-all approach. In terms of symptoms that an individual can have, it really can vary. There's a saying, if you've seen one person with dementia, you've seen one person. So we do really need to get to know that person and their needs and their preferences to tailor their care. And then we need to adjust our approaches to reflect the day-to-day needs and abilities. You may find that your individual has good days and bad days. They might be more responsive to certain approaches or techniques one day. They might work. The next day they might not. So we need to be mindful of that. We have a few more person-centered care approaches here. We want to provide the ongoing opportunities for engagement that have meaning and purpose. And we're going to talk more about that in a few slides, so I'll get back to that in just a bit. And then we want to ensure coordination among all those who are providing care. So we know family caregivers are taking on a lot of the care for people with Alzheimer's and dementia, but there might be other family members involved. Perhaps there is a home care company coming in to help provide care. So we need to make sure that everyone is in the know of what's working, what's not. Keep that communication open. It could be through the use of a journal, or maybe the family comes up with a unique system that fits their needs best. And then finally, create a safe and supportive environment that really reflects the person's characteristics, personality, and preferences. So we want to make sure, again, that their environment is safe and that they can still, again, do things on their own as much as possible. So while person-centered care can really be tailored to the individual. There are some techniques that we can combine with this person-centered care approach to help with these symptoms. So first, we need to remind family caregivers that in all situations, they should remain calm, patient, and empathetic. If the individual caring for someone with Alzheimer's or dementia, if they get upset, it's really only going to escalate the situation and make it worse. So there are some techniques listed here. The first is to really be present in the person's reality. If they think that they are 22 years old and that they're living on the family farm, perhaps the caregiver just steps into that reality and uses it to the benefit of the caregiver. They might say, well, you know, it's time to get washed up. You were before supper. Use those types of terms that they were familiar with, that they grew up with. Next is to not take things personally. If your loved one says something or does something that is offensive, don't argue with them. Don't try to correct them. It really, again, is only going to make the situation worse and not get it won't get you very far. Some things that I find to be helpful is when you compliment the person. Perhaps it's that they're looking nice today, or that they're doing a good job with the activity that they are working on at the time. Those little bouts of encouragement can really go a long way in building their self-esteem and help create a positive mood. We also want to avoid embarrassing the person. We need to remember that they are still an adult. They're still an individual. So, for example, if they spill on themselves or had an accident, you can even take the blame as the caregiver and say, oh my goodness, I'm so sorry I spilled on your shirt or your pants. Let's go and get you changed. So again, we don't want to avoid them. We want to help maintain that dignity. And then sometimes it's helpful to match the behavior. So, for example, if the individual is gesturing towards something but can't verbally explain what they want or need, you can gesture in the same manner and say, oh, that over there, can you go show me? Can you give me more information to help give you more information as maybe what they want or need? You might also try setting the person up for success. Breaking the activity down into more manageable steps is one good example of that. And then to do tasks alongside the individual and not do it for him or her. Again, we want to help maintain the person's independence level. So we can demonstrate, maybe if it's brushing of the teeth, you can gesture as to how, or brush your teeth alongside them so that they can see you doing it. Sometimes just those visual cues can go a really long way. And then again, use their life story to find creative solutions or ways to implement these techniques. For behavioral symptoms, there are several techniques that I have found to be very helpful. The first is to give simple choices. Sometimes if you just ask the individual, you know, what would you like to eat for lunch today? That can be a very overwhelming question. Instead, you could pare it down. Would you like a sandwich or soup for lunch? Or if they're getting ready, would you like to wear your purple shirt or your green shirt? Again, making the choices simpler still gives them that element of independence and control over the situation, but does not overwhelm them. And also, you will want to pause to give them the opportunity to respond. Again, the brain isn't working as a normal brain would. So whereas if you were to ask me, you know, would you prefer to wear the purple or green shirt, I could probably respond within a second or two, but it might take the individual upwards of 8 to 10 seconds to respond. So, you know, put a pregnant pause in there. Give them opportunity to process the question and then think of their response and then say it out loud. Again, you might apologize and take the blame. Maybe if they're searching around the house for their purse, you can say, oh my goodness, I'm so sorry, I misplaced your purse. Let's look for it together. And then you might also redirect their attention. If they are getting upset or agitated, redirect them to an activity that they really enjoy. Perhaps it's going out into the garden to look at the flowers, that sort of thing. Sometimes you might have to remove the person or an item from the environment. Sometimes whatever is happening outside in the neighbor's yard can be maybe visually distracting. So you could just close the blinds. Or if there is background noise, a TV, music that seems to be agitating or upsetting, turn that off. Or even moving them to a different room of the house can be an opportunity to redirect to a different topic. And then again, use those memories and their loved activities to offer these choices to redirect their attention. And earlier I talked about meaningful activities, and really there are 3 types of activities that you can engage the individual in. They can be physical activities, mental activities, social activities. The physical, it could be walking, going to a museum. Mental, it could be organizing things, sorting things, doing puzzles. For social, it could be get-togethers with relatives or going to a park and just watching the activity. And, sometimes it might be hard to get the individual to engage in the activity, so there are some techniques you can try. You might want to start the activity on your own. For example, if you're folding laundry and ask the individual if they want to help, that might not spur their willingness to do the activity, but instead if you fold a couple towels and then just hand them a towel, you might see that they engage in the activity. Or again, break it down into simple instructions, step by step, to help them complete the activity. Or simplify the task. Perhaps instead of having them bake a whole cake on their own, perhaps you add the ingredients and ask them just to stir or dump the ingredients in once you fill up the cups. And then you can also ask them to help you. It creates meaning and purpose for the individual if they're still able to contribute. So maybe you ask them to help you set the table. And even if they don't do it right every time, that's okay. They're still engaging in the activity. And then again, we want to personalize the activity based on their life story. I had a client who was a banker, and we found that he really enjoyed sorting coins. And that is an activity that he would do every morning at a time when he would have otherwise been agitated. And so, again, we used his personal life story to engage him. And sometimes during the later stages, families can find it hard to find activities, but we can engage the senses. We can show pictures. We can play music. We can use aromatherapy, maybe light a candle or bake their favorite meal for them to eat, or even touching different objects that are soft can be engaging. And families don't have to overthink it. Simple tasks of daily life can really be turned into activities that can be meaningful to that individual. So when we're thinking about the activities, the symptoms, the daily routine, we want caregivers to be proactive. We don't want them to overschedule the individual. We want them to be able to have time and flexibility within the schedule in case a symptom happens to come up and we need to use some of those techniques to minimize the symptom. But it is important to create structure and routine. Individuals living with dementia really become accustomed to different structure and routine, and it can help reduce the symptoms over time. And you might also be sensitive to the times that the person is most alert during the day or times when they're tired. So if you know mornings are when they are at their best, that's when you want to schedule a doctor's appointment or a visitor to stop by. And then keep a journal with, again, these key pieces of information to identify patterns, to communicate to others in the care circle, what's working and what is not. And then again, look for ways to help the individual maintain control over their life. Someone living with dementia or Alzheimer's is really experiencing a lot of decline. Perhaps they're losing their ability to provide for their activities of daily living, and that can be really challenging. So if we can find little ways throughout the day to help them maintain control, offer those simple choices, offer opportunities for them to engage in meaningful activities, that can really go a long way in helping them cope through this time. While it's challenging for the family members to watch their loved one, it also is challenging for the individual. Even if they are their brain is failing them, a lot of times they're still able to feel the emotions. They're still able to feel when the caregiver is anxious or when they're happy. So families just, again, need to be aware of that. But we've been talking a lot about these family caregivers, and they're really taking on a lot of the care. So it is important for caregivers to take care of themselves as well. We need to encourage them to learn about the disease. Knowledge is power, so the more we can equip them with information, the better caregivers they can be. Encourage them to maintain healthy habits. Go to their own doctor's appointments, making sure that they're getting exercise, that they're managing their emotions. Perhaps they need to seek counseling, join support groups, and utilize their social networks. I'm not just talking about, the Facebook type of social networks. I'm talking about engaging family members, friends, their faith communities, reaching out for help when needed. Maybe it's just having a neighbor run and get groceries, or maybe it's having a family member come over, or hiring home care to come in and provide respite so the individual can go out and get time away from the caregiving situation to recharge, to take care of themselves. And as professionals, we can encourage family caregivers in a variety of ways, and we can help remind them that their role is going to require some change. The individual is changing, and so the caregiver will need to change in their approach to the care. And always be mindful that with the disease comes a lot of change. So if we can prepare caregivers for that, it'll be less, hopefully, an easier transition. And caring for someone with Alzheimer's disease is doable. We want to encourage them that they are not alone. There are others out there who are dealing with this, and they can reach out to these communities of caregivers and interact with them. We also need to remind them that one size does not fit all. We've talked a lot about how symptoms will be different in various scenarios at different stages of the disease. They might be different from one individual to the next. But it is important really to encourage caregivers to do what you can when you can. Encourage their loved ones to maintain their independence, but encourage caregivers that it's okay that if they have to reach out for support, or when they can't do something any longer, it's okay to reach out for resources. And we can really empower the caregivers with tools, resources, clinical trial opportunities. I know I mentioned that earlier, but ways to engage and get involved. So as professionals, we can refer them to these resources, and so I want to move into these resources slides now. So those charts that I showed you earlier, so the severity of symptoms chart and the unmet needs chart, they actually come from this book called Confidence to Care, and it's a resource for family caregivers, and you can purchase a copy or learn more at confidencetocare.com. You can see that there on the slide. And then there's also a corresponding app that you can download for free on the website healthforalzheimersfamilies.com. And again, I apologize, I'll need to adjust the font on next month's PowerPoint. But this is an app. It has easy searchable tips right at your fingertips. It also has a 24-hour support line. So you can visit your app store and type in Alzheimer's Daily Companion to find the app in your app store. So again, you can search in your app store for Alzheimer's Daily Companion. Or if you visit healthforalzheimersfamilies.com, there is a section on there where you can get more information on the app. But I did screenshot. So on this app, it's really neat. I typed in the word bathing. So then you can see all these tips that pull up in regards to bathing. So if a caregiver is trying to think of maybe activities, they could type in activities and there would be suggestions that pop up. So I love this tool and resource, and I love sharing it with family caregivers. And then here are some additional resources. Oh, goodness, it cut off on the bottom again. I apologize. So we have healthforalzheimersfamilies.com. There's also the Best Friends Approach to Dementia Care, which is a great resource. It's written by Virginia Bell and David Troxel. If individuals do want to get connected via social media and in a social network, there's a great Facebook page called Remember for Alzheimer's Families that shares good information back and forth. between family caregivers. And then there's general caregiving resources on caregiverstress.com. And of course, the Alzheimer's Association has a plethora of amazing resources. Their website is alz.org. They also have a 24/7 helpline that caregivers can call at any point in the diagnosis process or at any stage of the disease to get connected to support and resources. And then also, if you want to learn more about those dementia care practice recommendations, you can go to their website to learn more. And then I know we've been talking about Alzheimer's disease, but if your loved one has dementia of a different sort, perhaps it's frontal temporal dementia or Lewy body dementia, there are some websites listed there with those corresponding associations. They're, again, a great resource. So I apologize that there's only a few minutes left for questions, but this is a topic that has so much information. It really could be covered over, an entire year's worth of webinars. So with that, I'll turn it back over to Steve for a couple questions.
Okay, great. Thanks, Lakeland. Let's jump right into the questions here with you. First question for you, Lakeland. Do you have any tips on how to best create a supportive environment for someone with Alzheimer's?
Certainly. Well, it's going to be different for every individual. However, some tips kind of in a general sense. You want to make sure that the areas of the home where there might be hazardous materials are safe and secure. So cleaning supplies, that they're locked in a safe spot. If the individual is no longer able to drive, perhaps the garage is an area of the home that is not accessible to the individual. We also want to create an environment that is really inviting for the individual to engage in meaningful activities on their own or with their family caregiver. So areas throughout the home where maybe they have a little rummage drawer where they can sift through some items. Perhaps there is some challenges in the bathroom. Want to make sure that there are grab bars available. Sometimes even just changing out the toilet seat for a darker toilet seat cover can be helpful in helping the individual see the contrast between the wall and the toilet. So again, there's lots of great information. I would also direct you to the Help for Alzheimer's Families site and the Alzheimer's Association's website for even more tips. And also, if there's an individual that is having issues with wandering, want to make sure that the exits of the home are secured and that the individual has a safe space to wander within the home. So those are just a couple quick tips, but there's so much more out there, so I would encourage you to visit those two sites as well.
Okay, great. Next question, Lakeland. Some people get day and night mixed up. Does it help to keep a nighttime behavior chart?
That's a good question. It is common for an individual to perhaps have times of wakefulness during the evening. There have been some great studies that have been done on dementia and sleep. There is kind of a sleep hygiene routine that you can get the individual hopefully into. Some of those hygiene activities would be to try to limit any napping that occurs during the day, especially in the later half of the day. So, at a time when they might be inclined to nap, you might want to engage them in an activity. Creating a bedtime routine can also be very helpful, and limiting the amount of liquid that they have perhaps after dinner time to prevent any additional restroom needs at night can be helpful. And also, especially times of the year, we're heading into fall and winter, and there can be prolonged hours of nighttime. So keeping the lights on in the home later into the evening until it's truly time for bed can be helpful to help with the kind of circadian rhythms. I know myself, even I get more tired, in the winter months when the sun goes down at 5 p.m. But if we can, again, try to keep that routine, that evening routine, it can help. But I would certainly say keeping a journal is really important because it can help, again, track patterns in the individual. And then you can also track, what is working, what doesn't work. And if it gets to a point where you need to consult a physician, having that journal of information of what you've already tried, what the patterns are, can be really helpful.
Okay, and one quick one here. You just mentioned talking about wandering, Lakeland. How common is this, and what are some common steps to take to prevent this?
You know, it's hard to say really how common it is. It is a common symptom, but it won't. Not everyone with Alzheimer's or dementia will wander. There are certain types of dementia that an individual could have that would make them more prone to wandering. But there's a great website. It's called preventwandering.com. And on there's tools and resources. Since we're running out of time, I would again encourage you to go to preventwandering.com. Also, the Alzheimer's Association has some great information on wandering. So there are some kind of safety measures that you can take. Perhaps one that has been successful is a dark or black rug in front of the doorway. Sometimes the depth perception, that individual perceives that mat as a hole, so they won't go over the mat to go outside and wander. So that's just one tip. I mean, there's so many out there. So again, I would go to preventwandering.com for more information, or download the app and type in wandering, and it'll pull up some resources there for you. But great question.
Okay, well, Lakeland, unfortunately, we have reached the end of our hour, and it's time for us to wrap up. But I want to thank you for a great presentation today and for being here with us. Thank you.
Thank you. Have a great rest of the week, everyone.